What causes unpredictable outcomes in photodynamic therapy? Imagine trying to light up a room with a flashlight, but the light flickers or dims unexpectedly. That's similar to what can happen in photodynamic therapy, where the results can sometimes be unpredictable. Several factors come into play that can influence how well the treatment works. First, the way the photosensitizer, or the special light-sensitive agent used in therapy, is absorbed by the skin varies from person to person. If the lesion is thick or deep, the photosensitizer might not penetrate enough to reach all the abnormal cells, making the treatment less effective. This is especially true for thicker skin cancers or precancerous spots like actinic keratoses, where the depth can limit absorption. Next, the light used to activate the photosensitizer needs to reach the targeted area. But skin acts like a barrier, and factors like skin thickness, pigmentation, and how deep the lesion is can limit how much light actually gets through. If the light doesn't penetrate deeply enough or isn't evenly distributed, some parts of the lesion might not be fully treated, leading to inconsistent results. That's why some practitioners use repeated or fractionated light exposures to improve penetration, but this can make the treatment more complex and time-consuming. The environment inside the skin also matters a lot. If the area is low in oxygen, known as hypoxia, the process that produces reactive oxygen species, tiny molecules that help kill abnormal cells, can be hampered. Since photodynamic therapy relies heavily on oxygen to generate these reactive molecules, low oxygen levels can reduce its effectiveness and cause outcomes to be less predictable. Individual differences among patients also influence results. Skin type, immune system strength, and the characteristics of the lesion itself all play roles. For example, darker skin tones might experience more prolonged discoloration or variable absorption of the photosensitizer. The immune response can also be unpredictable. Sometimes PDT stimulates immune activity that helps clear the lesion, but other times it might cause inflammation or unexpected reactions that affect the outcome. Pain during treatment is another factor. Some patients experience significant discomfort, which can limit how much light is used or how long the treatment lasts. This can reduce the overall effectiveness. Side effects like redness, swelling, or increased skin sensitivity also vary widely, impacting how well the treatment can be tolerated and completed. Finally, some lesions, especially certain types of skin cancers like squamous cell carcinomas, may develop resistance to photodynamic therapy or recur after treatment. This might happen because the tumor cells adapt or because the immune response is suppressed locally, making long-term success more challenging. In summary, the unpredictability of photodynamic therapy outcomes stems from a mix of biological, technical, and individual factors. Variations in how the photosensitizer is absorbed, how well the light penetrates, the oxygen levels in the tissue, and each person's unique skin and immune response all influence the results. That's why personalized treatment plans and sometimes additional strategies are important to optimize effectiveness and minimize side effects. Always consult with a healthcare professional to determine the best approach for your specific situation.